Hi, my name is Joe Brandon. I am here to do my health assessment head to toe for 3293. I'm going to walk into the room, wash my hands. Hi, my name is Joe Brandon. I'll be your nurse today. Can you please state your name and date of birth?
Matt McClure, 61087.
Okay. Can you tell me where you are right now?
Atlanta, Georgia.
Okay. I've already gotten Matt's vitals here. He is a 29-year-old male with a blood pressure of 113/80, heart rate of 68, pulse of 68, respirations of 17, temp of 98.9, and his pulse ox was 97%. He is 5'9", 160 pounds. Body mass index is 17 right now. And prior to doing this, I talked to Matt some. He does smoke, so I provided him smoking education, such as information as far as going to his primary care physician and seeking out medication that could possibly help him, possibly attending smoking cessation classes, even things such as nicotine patches that he can purchase over the counter. And so he states understanding of that. The first thing I'm going to do when I walk into the room is I'm going to do his Glasgow Coma Scale, and I'm just looking at his eyes. Matt, can you follow this finger? Can you follow it down to your right? Good. He scored a 4 as far as eye movement goes, and he followed complex commands as far as eye movement. So, can you do me a favor and can you again tell me where you are?
Atlanta, Georgia.
Okay. Again, verbally, he stated where he was, so that would be a 5 as far as verbal goes. And then, can you stand up for me, please? Can you move your right arm up, your left arm up, and how about your right knee up and your left knee up? Good. So that's a 6. So as far as Glasgow Coma score goes, he has a score of a 15. So he did very well there. I'm going to go ahead and I'm going to start by looking at the skin. I'm going to start with his hair. I'm looking for anything such as maybe lice, dandruff, any kind of vesicles that may be present, any acne. And he has very clean hair, no dandruff noted. And while I'm here, I'm just going to go ahead and I'm going to take a look at his skin from head to toe. I'm looking at his back here. He has a clean back. In a regular assessment, I would take off the shirt, but I'm not going to do that just for the sake of decency and integrity here. But he has clean skin here. Can I please see your arms, Matt? Arms are clean. I do see a scratch there. What's that from, Matt?
That's from my cat.
Okay. I'm looking at his feet. Can I see your... While I'm down here, I'm just going to go ahead and assess the nail beds. They are clean, dry, intact. The skin is appropriate for ethnicity. He has good cuticles on both feet. May I please see your hands? And again, I'm assessing the nails here. I'm looking for cleanliness, and that could be an indication of hygiene. His nails are clean. Cuticles look good. Other hand, please. All right, great. Now this hand's clean. Nails are appropriately colored for ethnicity. I don't see any clubbing of the nails, which would indicate like maybe possibly some hypoxia, which is lack of oxygen. If you're struggling with that. So again, now I'm looking at the face. I'm looking for symmetry. I want to make sure there's no lumps, bumps, or bruises. I'm feeling it's temporal gently, and I'm checking for any bulges. Looking possibly a tumor, one side a different size than the other, and that's not the case. They are both symmetric as well. While I'm here, I'm going to go ahead and I'm going to listen to the temporal artery. I have good brew there. It is present. So now, Matt, what I'm going to do is I'm going to check for TMJ. What TMJ is it's a condition that could cause you to possibly, for your jaw to lock up. It can cause severe pain. It can cause the things such as choking on food, you know. So I'm going to put my hands gently on your jaw. And what I'd like for you to do is just open and close it. Good. Okay, great. No signs of TMJ. I am going to listen to his thyroid gland as well. Good. It sounds great there. I'm going to go ahead and I'm going to check his glands now as well. The glands of the neck, the cervical, around the ears and whatnot. So the first thing I'm going to do is start off with the post-ocular ear. And I'm looking for any swelling. I don't feel any swelling at all. No tenderness. Is it tender at all? Is it
No.
sore? Okay. Now I'm looking for the retropharyngeal. Towards the front of the ear. Again, I don't feel any swelling, tenderness. Occipital now. Matt, do you feel any tenderness at all?
No.
I'm looking at the submandibular now. And I don't feel any tenderness or swelling. Now I'm going to look at the superficial cervical chain. The deep cervical chain and the clavicular, and I don't feel anything there as well. Okay, while I'm up here, I want to go and take a look at your eyes. I'm looking for accommodation, any kind of vergence. I'm going to do a 6 points of reference. So what I'd like for you to do is, if you could just, I'm going to gently sign this on you. If you could just follow my finger, okay? Great, eyes look wonderful. And also, now I'm going to check your peripheral field, okay? Can you just focus on my finger and tell me when you see my right hand start to come in?
Right now.
Okay. Other side.
Right now.
Okay, good. He has a great line of vision. There seems to be no issue with peripheral vision at all. If I could get you to stand up, please. And what I would like for you to do is stand here, and I would like for you to face this wall, if you don't mind.
Okay.
And I want for you to read the line, and again, we are 20 feet back, okay? So this is our Snellen chart here. I'm going to test his vision, okay? And can you tell me what line you can read from the smallest line you can read?
Okay. It's bottom. W, V, X, P, B, Z, S, U, W, G.
Okay, good. So he actually has 2015 vision, which means that he can see at 20 feet what most of us can only see at 15 feet. So that you actually have excellent vision, Matt. Now I have this piece of paper here, and what we're going to do is we're going to check your nearsightedness,
Okay.
to see how you read close up. So I'm going to hold this about 20 inches from your eyes, and just read the first 2 lines if you can.
Okay. No Place for Hate, Braves game, September 10th, 2015 at 5:30 p.m.
Okay, great job. And you can have a seat, my friend. Put this paper back over here. All right, now I'm going to look at your ears, your nose, and your mouth, okay?
All right.
Look at again for color, any kind of moles. The ears often are the most exposed to sun. The ears in the top of the head, a very common place for cancer to pop up, melanoma. If caught early, it's very treatable, but if caught late, it's deadly. So you want to make sure you always wear sunscreen, especially because you're pretty fair skinned.
Okay.
So both ears clean. Looks like he cleans his ears on a regular basis, at least that ear. Ears clean over here as well. Good job. Can I get you to just look up at me? Nose is clean. Open your mouth. Lift your tongue. Say ah. Okay, mouth seems to be clean. All right, now what I'm going to do is I want to talk to you a little bit about self breast exam, okay? And I'm going to actually perform a breast exam on you, okay? Can you get you to hold your arm up for me?
Yeah.
So what you want to do now, it's a common misperception that women are the only ones who have breast cancer.
Right.
A decent percentage of males actually get breast cancer too. And one way that you can catch it early, again, this is treatable if found early as well, is you can do self-breast exams. And what you want to do is you want to kind of take your fingers like this, and what we call is the pinwheel. You want to start at the nipple and work your way out, okay? Another way you can do it is start at the tail of Spence up here and work your way down. Now the tail of Spence is it's a gland, okay? And it's also a very common place for cancer to occur. And once it gets into your glands, it spreads to your whole body.
Okay.
So if you can catch it early, you don't want to go into your glands, you know? May I see this arm, please? Okay. Good. I don't feel any nodules. And again, I would suggest that you do this once a month.
Okay.
Okay?
All right.
Can you repeat it back to me, what I did? The pinwheel?
Yeah. Hold the arm up like this.
Yeah.
Start here. Go
That's
down.
correct. Good, good, good.
Yep.
Okay. Yes, sir. Now I want to to do something. I'm going to check for something called stereogenesis.
Okay.
And I'm going to do is I'm going to put an object in your hand, and I want for you to tell me what it is. Okay?
All right.
So close your eyes for me, and I'm just going to touch your hand gently. Can you tell me what this object is?
It's a pen.
Okay. Keep your eyes closed for me. And now I'm checking for gravitation. Just tell me tell me what I write on your hand. Okay?
Number 3.
Good job. Great. Okay. Now if you could go ahead and lay back for me, I'm gonna examine your chest. Okay.
All right.
So, again, for the sake of integrity, I'm not gonna pull up his shirt, but I am listening. I am going to listen to his chest, his heart rate, his heartbeat, his lung sounds. Okay. I'm assessing the color of it. I'm looking to make sure that the color is the same as his ethnicity. I don't have any redness, blotching, areas of dark pigmentation. I also want to look for moles. The chest, especially the upper chest, is also a very common area for skin cancer to occur, breast cancer, as we mentioned previously. So I'm going to go ahead and I'm going to listen to your heart sounds. I'm going to really focus on S1 and S2. Now I want to hear that lub dub. I'm going to be paying attention for any murmurs, swishes that I may hear that may indicate a leaky valve or a heart murmur. That was okay. So I'm listening to S1 now. S2 sounds good as well. So if I could get you to sit up for me one more time.
Yeah.
And if I could get you to stand up for me, please. And if I could get for you to bend over and touch your toes.
Okay.
I am looking to make sure his spine is symmetrical. I want to make sure that he's not displaying any signs of a scoliosis or any other disorders of the spine. Spine does look symmetrical. I don't see any bulging. Do you feel any discomfort?
No.
Matt doesn't feel any discomfort either. You can go ahead and take a seat, my friend.
All right.
I'm going to go ahead and I'm going to feel your pulses. I want to make sure they're even bilaterally, okay? And that I don't have any edema in your extremities. I'll be checking that with your pulse as well. Oftentimes, lack of circulation can lead to decreased pulse sensation, decreased feelings in the extremities. So,
Okay.
I'm going to start off with your femoral. I just want to do one at a time because I don't want to cut off circulation to his neck or to his head. It could actually cause an individual to pass out, and possibly for long enough it could lead to death. So, just feeling the great carotid pulse. While I'm up here carotid, I also want to listen to the carotid. I want to hear the root of it. Good root on this side. Good root on this side as well. Now, if I can get you to just hold your hands up for me and put your palms down. Right now I'm feeling your brachial pulses. Pardon me, radial pulses. Okay. I'm going to move on up here. I'm going to actually get on my knees just because it's more comfortable for me and for my client here. I'm going to feel my radial pulses. Good. I'm going to come on back here. These are oftentimes a little harder to feel, but the brachial pulses. I'm sorry, the popliteal pulses. Pardon me. Yeah, a little nervous feeling. Good. See this thing. This popliteal is good. This popliteal is good. Now I want to check your posterior tibial. So just feel. Good. Let me see this way. Good. Now I'm going to check the dorsalis pedis, and these are often again, difficult, especially if you have a patient with CHF, a client who has extreme edema, diabetes, possibly anything that could lead to a decrease in circulation. Yeah, see your foot. Got to have a strong +2 pulse rate. And again, I have a +2. If you can get you to lay back for me one more time.
Yeah.
I want to listen to your femoral pulse here. Good, strong femoral pulse. Matt, you can go and sit on that for me.
Okay.
Now, I want to check your muscle tone since I don't have an examination manual. I'm going to use the tip of my stethoscope, okay?
Okay.
So the first thing I want to check is I want to check your bicep, okay? And again, I'm just checking for muscle tone, muscle reaction here. Okay, good. Well, back here, I want to go and check your tricep. Okay, good. And I'm going to see this arm, please, if you could hold it up. Good. And your tricep. Good. Okay, now what I'm going to do is I'm going to go ahead and I'm going to hold your leg up. Since we don't have a operational assessment table, I will help hold his thigh up just to assess my popliteal muscle reflex, okay? Let's lift this up. One more time. Okay. And this is actually my patellar. This is my patellar. Good. Okay. Now, Matt, what I'm going to ask you to do now is we're going to move on to the neuro aspect of the assessment.
Okay.
Actually, I need to pause here. I need to go back. I did not listen to Matt's lung sounds when I did the chest exam, so I would like to go back and actually listen to his lung sounds. Matt, I'm going to listen to your lung sounds. As we talked about, you are a smoker. Yet, due to your age, you likely have not suffered any serious consequences yet. So it'd be a good time to stop. You are a young, healthy male, so now's a good time to quit. All right. Okay, deep breath in for me. Breathe out. Good. Deep breath in. Breathe out. I'm listening to the 6 quadrants on each side of the chest, frontal and posterior. Deep breath in. Deep breath in. Breathe out. Deep breath in. Breathe out. Good. Deep breath in. Breathe out. Excellent. Now moving on to the other side, and then I'll go posteriorly. Deep breath in. Breathe out. 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 Okay, good. Lungs sound good. They're clear, equal bilaterally. I don't hear any rhonchi, any crackles. I don't hear any wheezing. I don't hear any signs of congestion. You know, again, this is September. It's flu season, so especially geriatrics, infants, and people with things such as renal failure, diabetes, CHF, HIV. These people are the most are at a higher risk of acquiring pneumonia. But anybody is susceptible. I'm sorry, not pneumonia, but the flu. Anybody is susceptible to getting the flu. Those people are at especially higher risk. Same goes for pneumonia. Mainly the elderly, but also people with acquired immune disorders, renal failure, diabetes, CHF, COPD, disorders of the lungs. These people are at a higher risk of pneumonia as well. So, okay, now what we're going to do is what I'm going to do is I'm going to hold my finger right here. And what I'd like for you to do is I'd like for you to touch my finger to your nose, okay?
Okay.
And again, I'm just looking at coordination, all right? I'm looking to make sure that there's no neurological deficits, okay?
Okay.
Yeah, good. More time. Good, okay. Good. And good. Okay, now if I can get you to stand up.
All right.
And I want for you to stand beside me.
Okay.
And I'd like for you to walk heel to toe, okay? To that, to that wall and back to me, okay? I'm looking at his movement. I'm watching his balance. I'm making sure he's not dizzy or tiptoeing. Nice, man. You can go ahead and take a seat, sir.
Okay.
He seems to be having great balance, no issues with balance. Okay, now what we want to do is we want to do alternating movements. Again, oftentimes if there's a neurological disorder, there may be a hiccup in rapid movements, okay? So what I want for you to do, Matt, I want for you to come down with your hands. Okay, so lap, up,
Okay.
lap, up, okay? Good. Yep. Faster. Good. Faster. Good. Okay, perfect. He doesn't seem to have any issues with coordination. He followed those complex commands well. He did it without any stuttering or stopping or hiccuping. If I can get you to go and I'm going to go ahead and listen to his abdomen now. This is a good time to go ahead and check out the abdomen. If you can go and lay down for me. Okay, I want to listen to all four quadrants. What I want to hear is normal abdominal sounds. I don't want to hear hypoactive. That could mean constipation. Hyperactive could indicate some kind of GI problem. So, again, all four quadrants. Once again, in the clinical setting, I would typically remove the shirt or go under the hospital gown, but I'm just going to go on top of the shirt for this video. Good. While I'm down here, I'm going to go ahead and I'm going to palpate the abdomen. I don't want to feel a spleen. I don't want to feel anything swollen. That could indicate an issue with one of the organs, possibly spleen, liver. I don't feel any bulging. His stomach is flat, soft, tender to touch. Do you feel any pain? No pain. Another thing I want to do is I want to go ahead and I'm going to palpate the chest while I'm up here. It has happened more than one time that in report I've got the patient, and they haven't told me that the patient had a pacemaker and an IED, and I discovered it through self-assessment. So again, you're not going to necessarily catch that always when you listen, but that's why you have to touch your patient. You have to palpate because they can be hard to miss, especially over a hospital gown. And again, that's a pertinent piece of information. We have to know and should be giving a report that our patient does have a pacemaker or an IED. As far as in case something was to go wrong with it, we need to know for MRIs. I mean, so it's very important to hand that off in shift reports. So again, I don't feel any tenderness in your chest. No, his chest is soft to touch. No issues here. He is muscular until he works out. He's a healthy young man. Okay, so now I'm going to listen to I'm going to listen to the arteries of the abdomen. First one I want to listen to is the aorta. I want to listen to the renal. Good pulse sensation on both sides. I want to listen to the iliac. Good. And I've already listened to the femoral, okay? That would be included in that assessment right there. Okay, you can go ahead and sit up, Matt. Thank you so much. Now I want to move on to my neuro assessment. The first thing I want to do is I want to test nerve number 1, is olfactory nerve, okay? So Matt, what I'd like for you to do is if you could just close one nostril for me and close your eyes, okay? Now I want for you to tell me what and if you smell anything.
Peppermint.
Good. Okay. Other side?
Peppermint.
Okay, good. So the olfactory nerve is intact. Now I want to check nerve number 2, which is my optic nerve. And I just want for you to look at my finger. I want for you to follow it. And I'm making sure his eyes move side to side. Now with optic nerve number 3, the ocular, I'm going to be testing for constriction. I want to make sure he has pearla intact. Eyes are equal, round, restrictive, bilaterally. They want to be I want for them to constrict to light, okay? And make sure that they, oftentimes if one constricts and another doesn't, it is definitely a sign of a brain injury, okay? So what I'd like for you to do is just look straight ahead at me. Good. Good, okay. Eyes constrict, pearl is intact. Now I'm going to check your trochlear nerve. If I can get you to just look up for me. No, I'm sorry. Keep your head straight. Look up, straight up. Good. Now look straight down. Okay, perfect. Now I want to check your trigeminal. If you could move your mouth up and down for me. I want for you to puff out your cheeks. Okay, good. Another thing with the trigeminal is I want to go ahead and I want to. Can you close your eyes for me? And I want for you to tell me what I have here, okay? Is I have I'm sorry, Matt, you can open them. I have a Q-tip, I have a soft tip, and I have a tip that's been broken off. That would be considered the hard tip. This will be considered the soft tip, okay? Okay. So I would like for you to tell me when you feel, if you feel and what you feel, whether you feel hard or soft and on what side, okay?
Okay.
Okay, close your eyes for me.
Left side soft.
Okay.
Right side hard.
Okay.
Left side hard. And right side soft.
Okay, great. Now, again, I want to check your abductus, and if I can get you to just look side to side for me, both sides, great. Okay. Now I want to check your facial muscles. I want for you to smile real big, frown, and again puff your cheeks out. Good, facial muscles are intact. Now acoustic nerve, okay? What I'm going to do is have you ever had any hearing loss before? No? Okay. What I want for you to do is I'm going to stand behind you and I'm going to make a sound in one of your ears. And I want for you to just raise your hand when you hear the sound, okay?
Okay.
Okay. Acoustic nerve is intact. Now what I'm going to want to do is I want to check your tongue, okay? Your glossal nerve. So typically what I would do is I have a tongue suppressor here. And what I'm going to do is I'm going to just, another thing that you would do at the doctor is check your gag reflex. I'm not going to do that at home just because it's, I don't want to cause any discomfort to my client here. But what I am going to do is I'm going to check the muscle tone in your tongue, okay? I'm going to make sure everything's symmetrical, all right? So if you could stick your tongue out for me, okay? And if you could just move it around that thing. Good. Glossal nerve seems to be intact. Open your mouth again for me. Say ah. Vocal cords are intact. Well, okay. So moving on to 10. I just did the vocal nerve, so that was completed there. So when I check the spinal accessory, what I want for you to do is I want for you to shrug your shoulders.
Okay.
So just shrug them up and down for me. Yep. Good. Spinal accessory is intact, and hypoglossal nerve number 12. I just checked that. So now I'm going to do another part of the neurological exam, but also just a part of checking for things such as diabetes, CHF, renal insufficiency. These things can lead to a lack of sensation. Okay, peripheral vascular disease. Any of these things can lead to a lack of sensation and cause serious injury. People burn themselves because they don't feel their foot on a hot stove or in hot water. I have many patients who are paraplegic who run over their foot and they don't feel it, you know. So we're going to do something very similar to what we did with your face as far as checking the nerves. We're going to do that around your body and your extremities, okay?
All right.
So if I can get you to do me a favor, just again, this is hard. This is soft, okay? You just tell me what limb you feel it in and whether it feels hard or soft, okay?
All right.
Okay, so close your eyes for me.
My right arm hard.
Okay, good.
My right arm soft.
Great.
My left arm hard.
Yeah.
My left arm soft.
Okay, good.
My left hand hard. My left hand soft.
Okay.
My right hand hard. And my right hand soft.
Okay, great. And again, the feet are particularly important. They are a very common area of injury. So, or a very common area that lacks sensation, and it can be one of the early warning signs of things like CHF, PVD, diabetes. You want to really catch those things as early as you can, so that you don't do more harm, end up with amputations, wounds, things of that nature. Okay.
My right foot soft.
Okay. Good.
And my right foot hard.
Okay.
My left foot soft. And my left foot hard.
Good. Okay. Now I'm going to do something. You did very good, Matt. No lack of sensation, full sensation. Now, if I can get you to lay back for me, I'm going to do something. I'm going to check the Babinski reflex. We want to have a negative Babinski reflex. What this should indicate is what the Babinski reflex is. I'm going to take something that might be considered ticklish or hard or whatever, and I'm going to rub it up against the padding of the foot. The feet should come in. They should constrict. In babies, oftentimes, they flare. That would be considered a positive Babinski reflex. However, if that happens in an adult, it could indicate a severe neurological problem, okay? So again, since we don't have an actual assessment table, I'm going to improvise, and Matt, if I could just get you to lift your foot up, I'm going to put it on my knee, okay? And this may tickle you a little bit, but again, I want to get a negative Babinski reflex. That's what I'm looking for. That would be considered normal. Abnormal would indicate a possible that I need to do that the doctor needed to possibly get an MRI or a CT scan, because neurologically there may be something not going on correctly. Okay, here we go. Okay, good. That was a negative Babinski. And again, I'm sorry, Matt. I know that this isn't very comfortable. Good. All right, perfect. Matt, go ahead and sit up for me. Do you have any questions for me?
No, I think I'm all good.
Okay, and have you been experiencing any new health problems?
No.
Have you started any new medication? Are you on any medication?
No, just like allergy relief stuff.
Okay, and it's over the counter or prescription?
Over the counter.
Okay, and you do exercise?
Yes, sir.
About how many times a week?
Probably 4 times a week.
Okay, wonderful. Again, if you could work on smoking, that would be great. I think that you're a very healthy young man otherwise, you know. And that really concludes my assessment today. Thank you so much, and very grateful. Have a good day. Thank you.